Good evening. My name is Nicole LaChapelle. I'm the mayor of Easthampton. Tonight we have a forum that focuses on COVID-19 and vaccination. I'm very happy to welcome to our panel Dr. Esteban Garcia, who is Cooley Dickinson's Chief Medical Officer, Dr. Joanne Levin, CDH's Medical Director of Infection Prevention, Bree Eisenstadt, our newly appointed health director as of today, very well-earned promotion. Congratulations, Bree. Amy Hart, which is the City of Easthampton's public health nurse, and we have Karen Moyano-Camihort, who is, I'm going to learn that the name. My apologies, Karen. And Karen is translating in the chat that said we're asking everyone to ask questions during the presentation in the chat. The questions will be translated into Spanish, or if you'd like to write a question in Spanish, we have Karen at the ready to make sure that your voice is heard. I'd like to remind everyone that this forum is being recorded, that everyone is mute except for the panelists. We're going to, again, answer questions at the end of the forum, so we leave enough time for all of the presenters to get through their material. And we will start right now with the presentation. Bree, will you be starting us off, or will it be one of the doctors that joining us?
Dr. Levin and Dr. Garcia are going to go first, and then Amy Hart, and then I will finish.
Great. Okay.
Great. Welcome, everyone.
Excellent.
Thank you so much. We're glad to be here. I'm going to share my screen. We do have some slides, and we're going to go through pretty quickly. Okay, can everybody see that? Okay. Why does that do that? Okay. Okay, so I'm going to talk about the vaccines that are going to be available in Western Massachusetts, and they're the same two vaccines that are available countrywide. Their two vaccines are known as Pfizer, which is made by the BioNTech company out of Germany, and Moderna, which is a company outside of Boston. Both vaccines are made with messenger RNA, and I'll explain that in a few minutes, in a lipid, little fat bubble. And neither of them contains some substances that people have concerns about: eggs, antibiotics, mercury, latex, or thimerosal. None of that. The two are slightly different, but very, very similar. And the way they were studied, the Pfizer was studied in people 16 and over, and the Moderna is approved and was studied in people 18 and over. They're given slightly differently. The Pfizer is a dose of 0.3 mLs and Moderna is a dose of 0.5 mLs. That's just the way they're made, and they were studied that way. And the time between doses for the Pfizer is 3 weeks, whereas Moderna is 4 weeks. And I can't tell you why the scientists who made these vaccines decided on those protocols, but that's how they were studied, and so that's how we give them. Both vaccines were approved under emergency use authorization by the FDA. Both require 2 doses. The doses are given in the muscle of the deltoid, the upper arm. They are not live vaccines. They are dead. You cannot get COVID from any of these vaccines. But one thing you should know is that it's not recommended that you take other vaccines within 2 weeks of your COVID vaccination, such as a flu or pneumonia vaccine or shingles vaccine. There's no known problem with taking another vaccine within 2 weeks, but because there's no information, the CDC recommends that you space your vaccines out by 2 weeks, just in case there be any chance that one would affect the efficacy or the efficiency of the other. And the COVID vaccination is free. When you sign up for vaccine, they will ask for your health insurance information, because there's an administration fee that they can charge your insurance company, but the vaccine itself is free. So this is how messenger RNAs work. Normally, this is a cell, like a cell in the muscle in your arm, perhaps. And our normal bodies have a nucleus where our DNA lives. And our DNA tells our cells what to do by sending messenger RNA out into the rest of the cell. And this ribosome is a part of the cell that makes proteins. And this messenger RNA tells your cell what kind of protein to make. Where'd my pointer go? But for the vaccine, here you have the little bit of messenger RNA in the lipid envelope. That lipid envelope can get into your cell because your cell recognizes it as something similar. So it opens up and lets it in. And this messenger RNA does not go in your nucleus, and it does not stay in your body. It actually does the same thing your own messenger RNA would do, is get turned into, gets translated into proteins. Now, these proteins are sent out by this cell and send them out into your body so that your immune system can recognize them. And that's how it works as a vaccine. Your immune system recognizes the spike protein as a foreigner and develops immunity against it. When I first heard about this new kind of vaccine, I was very concerned about how long this messenger RNA would stay in our bodies. And our own messenger RNA, which comes out of our nucleus, only lives in our cells for maybe 2 hours. They've engineered this messenger RNA in the vaccine to live a day or two, but it does not stay longer than that. And so you can rest assured that that messenger RNA is broken down. I've lost my pointer. Here it is. Is broken down and does not stay in your body. So the Moderna vaccine was studied with 30,000 volunteers, all done in the United States. So that's 15,000 got vaccine and 15,000 got salt water. They got 2 injections, and this was only over 4 months. And of all the people, of those 15,000 in each arm, 11 volunteers got COVID who had the vaccine, and 185 who got salt water got COVID. And that difference is where we get what you've heard is 94% efficacy. 30 out of the 185 had severe disease, and all of them were in the placebo group. So it appears that even though some people getting the vaccine did have disease, all the severe disease was in the placebo group, meaning the ones who did not get the vaccine. So it's very, very effective for preventing severe disease, and that's the most important thing. As far as safety, most people had redness or pain at the site of the injection, meaning a sore arm, after both the first and second dose. As far as other kinds of reactions, systemic reactions, these are expected things that happen after many vaccines. About half had tiredness, headache, muscle pain, chills, or joint pain, nausea or fever after the first dose, and about 3/4 had it after the second dose. So it's pretty common, but generally it's mild and generally lasts 1 to 3 days at most. And this is the chart that shows us the difference between the placebo group in gray and the vaccine group in blue. Each little tick mark is a day that goes by. And on the left-hand side is incidence of COVID, of getting the disease. And so you can see that these heavy arrows are the 2 doses at day 0 and day 28 for Moderna vaccine. And you can see that these graphs sort of diverge somewhere around day 13, 14 or so. And the people who got the placebo kept increasing, kept going up on the rate of developing COVID. And the people who got vaccine was a very, very low rate of COVID. And so which groups were studied? Everyone did well. So we had people who were 18 to 65, they did well. The group over 65 did not do quite as well. Their efficacy was 86% as opposed to the 94 and 95%, but that still is excellent. We also looked at, they also looked at men versus women, both did well. People who were at risk for disease and people who had no risk factors for disease both did well, although the risk group didn't do quite as well. And people often ask about communities of color. People of color were included in these studies, and they did quite well as well. The other vaccine we have is the Pfizer vaccine. Again, a few more people, so about 20,000 in each arm. Again, got 2 vaccines. They were 3 weeks apart. Again, it was a few months of study, so it wasn't even a year. But again, the people who were given the vaccine, only 8 out of 20,000 or so got disease, and 162 who had the placebo got the disease. Again, the difference is makes a 95% efficacy. Again, of the people who had severe disease, 9 of them got placebo. There was 1 patient who got severe disease who was in the placebo group. And as far as safety, again, very common to get an injection site reaction, pain or swelling in the arm, and systemic reactions about a half or 2/3 the second dose. But when I say systemic reactions, those are things that are not just localized to the arm. These are not allergies. These are just general reactions from the development of immunity. People often get muscle pain, joint pain, chills, and that kind of thing. So again, this is the graph of the Pfizer results, and each circle or square here is a patient. So you see these graphs overlapped again until somewhere around day 12 or so, and then the people who got the vaccine, very few people got disease. This is the 1 person. The filled in boxes are the ones who got severe disease. 1 person in this whole study of 4 months with tens of thousands of people got severe disease. There were a handful of people who got the placebo who got severe disease, but most people did not get severe disease, and that's what we know about this disease. Most people do well. But very dramatic results, very dramatic difference between the groups. And just a word about, some people are concerned that with Operation Warp Speed, that there wasn't enough oversight into the development of these vaccines. And I disagree with that. I said I'm feel that the same oversight that is given all vaccines was given to this vaccine. It went through the same steps that all vaccines go through, development, and then phase 1, phase 2, and phase 3 trials, review by the FDA. But then also there's another organization called the Advisory Committee on Immunization Practices, which is a group of scientists and doctors who look very closely at vaccines and make recommendations on whether vaccines should go forward and how they should be used. And they were in favor of this. And they're continuing to do monitoring, both the CDC and the FDA. And I'll say also that at our hospital, we're affiliated with Mass General, and we have a number of scientists there who also independently reviewed these vaccines and also agreed with their use. So talk a little bit about who should get vaccinated. Can pregnant people be vaccinated? The answer is yes. A pregnant person can get vaccinated. The problem is pregnant people were not brought into those studies. So we don't have a study of people who were pregnant at the time of their vaccinations. We don't have that kind of data. There are a handful of people who got pregnant right after getting the vaccine, and there's no evidence of any problems with those pregnancies. But one thing we do know is that pregnant people are at somewhat increased risk of having severe disease. And so pregnant people, in Massachusetts, it's recommended that pregnant people do get the vaccine. There is some debate about this because we don't have the data. And so I think the bottom line is that each person should make the decision for themselves after conversation with their provider. And things they might want to take into consideration are things, well, how much COVID is there? What is the risk to them? What is their personal risk? Do they have other risk factors? How good are the vaccines? And right now we think the vaccines are excellent. And the fact that there's no data during pregnancy, there's no reason to believe it would cause any problems. But again, there's no data. For lactation, there is no data about lactation and getting the vaccine. There's no reason to believe it would cause a problem. It is not a live vaccine, should not cause a problem for an infant. But again, there's no data. So how about people who have had COVID? I think a lot of people have questions about this. It is recommended that people who have had COVID get vaccinated. When people have COVID, they may have a severe disease, but they also could have very, very mild disease. And some of those folks with mild disease may not develop the kind of antibody reactions and the kind of immunity that you might get with a vaccine. So because the immunity after natural disease is so variable, we do recommend that people who have had COVID do get the vaccine. We certainly want them to be better from their illness before they have vaccine. And we certainly want them to be outside of their isolation period. We don't want them coming to our clinic and infecting other people. But they certainly are recommended to get vaccine. If a person was infected in the last 90 days, we think that it's very unlikely that they would get COVID again. So if there's a shortage of vaccine, they may choose to defer their vaccination for 90 days because they're not at high risk anymore. Some states are mandating that. Massachusetts is not mandating that at this time. Just one caveat, it doesn't happen very often, but some people are treated with medications called monoclonal antibodies or convalescent plasma. And if you were someone who was treated with either of those, you should wait 90 days after those treatments before you have your vaccine, because it may cause the vaccine not to work as well. How about people on immunosuppressive drugs or cancer chemotherapy? Again, we have very little data about the use of these vaccines in this population. There's not as much concern, there's not really a concern about it causing harm. The main concern is whether the vaccines will be efficacious, whether they'll really be protective, because these people don't mount the same kind of immune response as people with a healthy immune system. So at this time, it is recommended that immunocompromised individuals get the vaccine, but they are studying these folks to see if maybe they need a booster shot sooner, or additional doses, and that's true for all of us, but particularly for these people. So who should not get the COVID vaccine? We do not want to give it to anyone who is allergic to the vaccine or any components of the vaccine. So anyone who's had a severe allergic reaction after their first dose should not get a second dose. And this is exceedingly rare. This is something like 2 to 5 people per million. I mean, this is a really, really rare thing. Anaphylaxis is the name for an allergic reaction that is a specific kind of reaction that occurs within a few hours of the vaccine. And most of the rare anaphylaxis reactions that have occurred within a few minutes. So that's why people are observed for 15 minutes, and anyone with a history of allergy will be observed for 30 minutes. The other components of the vaccine that we want to make sure people are not allergic to are polyethylene glycol, and something related to it is polysorbate. Polysorbate is not in the vaccine, but it's related to the polyethylene glycol. So if you know you have an allergic reaction to those things, you should not take this vaccine, or you should go see an allergist first. Anyone who has taken Miralax, Go Lightly, or had an injectable steroid has probably had polyethylene glycol. And if you've not had a reaction to any of those things, then it's probably very safe for you to take this vaccine. Polysorbate is similar to something that's in a chemotherapy drug, and people have had reactions to that. So if you're allergic to those things, you probably would know it. And if you're not allergic to those things, you probably can take the vaccine safely. So we do take caution for people with moderate or severe illness of any kind. We don't want to vaccinate people who are sick. Then it's very hard to tell what's a vaccine reaction and what's complications of whatever illness they have. So you'd rather defer vaccine for people who are ill. And in people who have an immediate allergic reaction to any other vaccine or injectable therapy, it does make sense to meet with an allergist and just clarify what component they were allergic to, and make sure that it's safe for them. So again, what can you expect after vaccination? You can expect almost everyone gets pain or swelling in their arm, but a good portion of people get mild fever, chills, tiredness, and headache, and these are normal. This may be a sign that your immune system is mounting an immune response. It is not long lasting. And one thing to know is that it does not cause respiratory symptoms. If you develop a runny nose, a cough, a sore throat, you need to be checked out for other things, including COVID. We have seen cases of people developing COVID soon after getting the vaccine, and it's likely that they were incubating the COVID before they got their vaccine and then developed their symptoms after vaccine. So if you do develop respiratory symptoms, that is not a vaccine reaction. And the CDC has a program that you can enroll after your vaccination, and it can text you and you can tell it what symptoms you're having, and it can give you recommendations on what to do. Of course, you can always contact your provider. Okay, Dr. Garcia, you're up.
All right, good evening. Thanks so much for joining us here. So I'll just pick up where Dr. Levin left off. So I think the big question is who's eligible currently, and as of the beginning of February, we were, not only was it phase 1 individuals, so that's those folks working in healthcare, first responders, long-term care facility folks, those were all eligible before February 1st, and after February 1st, we added individuals that were 75 and above. Many of you know that the CDC has said 65 and above, but the state has different guidance that they're working through. So at this point, it's 75 and above. Next slide. So information really looking at how do you figure out where to go to get vaccinated. And there's lots of opportunity to look at the state website, which will tell you where are the vaccine sites across the state. And you can get vaccinated at any of those. So it's not as if you're limited to just local Western Mass. If you wanted to travel, you could actually make an appointment and travel and get vaccinated in Central Mass or in Eastern Mass as well. Next slide. So here's a way to find your local area to get vaccinated by putting in your zip code using the COVID vaccine locator. So a real nice addition to finding where to get vaccinated. Again, this is looking at Western Mass and specifically looking to see which areas will be able to vaccinate you. These are large, tend to be large state-run or DPH-run sites that are available as well. Thank you. So there is a new option from looking at that the state has come out with, and this is dialing the 211. And so this is really here dedicated to help folks 75 and over navigate how to get vaccinated. It actually is working incredibly well, and I think our community of 75 and older are being helped tremendously to get through the system, because it can take some time to navigate the system and learn how to do it. It's open Monday through Friday, 8:30 to 5, and there's folks that will speak to you live as well in English and in Spanish, so it's not just a computer prompt. Next slide. So locally, I'm going to, as of this morning, this slide was accurate. This slide has changed as of this morning. So unfortunately, for a lot of different reasons, but primarily vaccine availability, the state has decided to pull back on allowing large medical groups and hospitals to vaccinate primarily, at least for the next 2 weeks. We don't know when they'll let us vaccinate again. But at this point, they're really driving individuals to their state website and then the state sites that are available. So I didn't speak with Valley today to know if they have any vaccine, but at Cooley, we no longer have vaccine until the state allows us to vaccinate first folks again. So I think one of the big questions is, so what's next, right? Who gets vaccinated next? So we're hopeful that individuals 65 and above with plus or minus 2 comorbidities would be allowed to get vaccinated, probably not until the end of the month. That's using a little bit of a crystal ball. It could be the beginning of next month. So hopefully as vaccine becomes more readily available, we'll be able to then open up vaccines for more individuals. Next slide. So when we talk about comorbidities, it's really thinking about things that make you or your family members at higher risk for COVID and at higher risk for having trouble when you get COVID, right? So lots of folks get COVID and do incredibly well, typically healthy folks. But those who have obesity, chronic kidney disease, chronic lung disease, really severe obesity, we talked about pregnancy, those folks, diabetes, are the ones who are going to have significant issues. And if you have two or more of those, then folks are allowed to get vaccinated in that next wave with the 65 and over. So reasons to get vaccinated is because it's really important to protect yourself. It's important to protect your family. The other thing we're looking for is something called herd immunity, which I know we've all heard people speak about that. But to get there, we need 80 to 85% or more of the population vaccinated, and so it's very important. It's also important to be a role model. Be proud when you get vaccinated. I can tell you that our healthcare workforce, very proud to have been vaccinated, feel almost a sense of relief that they've been vaccinated and they can continue to take care of patients the way they have been before. It may be required to attend school for folks to go back to school. I have an 18-year-old, my son, living in my basement. At some point, hopefully they'll let him get vaccinated so that he can go to college in the fall, because one or two of us is going to have to, he's either moving out or I'm moving out, but something has to happen. To travel, potentially it'll be required. And then finally, even potentially to go back to work. So those are not required now, but they might when it's more readily available. So again, one of the questions that keeps coming up for us, and I think this is interesting, is so if I've got my 2 vaccines, am I done, right? Can I now travel? Can I go eat at a restaurant with a group of folks and not wear my mask? So, really thinking about how I think we all believe COVID is not going anywhere. It's staying with us. It will become probably something we have to manage on an ongoing basis. But vaccine is just one of those layers that's helping us prevent the spread of the COVID and the disease, but also all of the other things that we tell you that you should be doing with all the social distancing, wearing your masks, really good hand hygiene, are going to continue. Someone asked on a call I was on this morning, when do you presume the new normal? When is it going to happen? When would you guess? And what is the new normal? And it's really hard to say. I think in general, we're hopeful that at some point in the fall, we'll be able to go back to doing some of the things we were doing before. The question of a handshake, is a handshake ever going to become, something we want to do moving forward? Maybe with a little bit of, hand sanitizer on the side. I don't know. It's going to be a challenge to know if you want to take that risk. But I think in general, we just need every layer here to get us past this and then to be able to move on to what becomes our new normal. All right. And I think we're going to move on before questions. So.
And Bree?
Yes, let me pull up Amy Hart, our public health nurse, her PowerPoint, and I will share my screen in 1 second.
Thanks, Bree. Hi, everybody. I'll just get going by introducing myself. So I am, as the mayor said, the public health nurse for Easthampton. This is actually a new role. I've been in this job for a little over a month. And so in that time, I've gotten to know a lot of you through phone calls. I spend most of my day making phone calls to people in Easthampton who have tested positive for COVID and their close contacts. So through that, I have gotten a lot of information about how things are going. So we are tracking what's happening in Easthampton, and I have a slide showing where you can see weekly updates that are being posted on the main city website. This is just a snapshot. It's a moment in time representing the previous 2 weeks, and it's been, the data's been brought to a rate so that it can be compared across communities. This is from last week, representing the 2 weeks. And as you can see, we were in the medium risk category. I took a look at what's been going on since the beginning of the year. That's going back about 5 weeks so far. We've seen over 350 cases in Easthampton since January 1st. But researchers tell us that the reported cases are likely quite underreporting what's actually happening. There's evidence that it may be more like 3 to 10 times greater, that number, and that includes people who are asymptomatic and never get tested, people who have minor symptoms and don't think to get tested or just prefer not to test, or maybe have difficulty accessing testing sites. So we know that there's a lot more out there. Within the group of cases that we do have confirmed, I'm seeing that so far this year, the highest number of cases has been among the age groups 19 to 29. And then just below that, the groups between the ages between 40 and 59. So there's a couple generations being represented there. And that's really what I'm seeing as I talk with people. I'm seeing a lot of household spread and cross generations. And of course, many people have no idea where they were exposed to COVID. I think a lot of people are trying hard to stay home and, maybe just go to the grocery store or into the office once a week. But at the same time, we also have, as I'm hearing, people are a little bit more relaxed than they were last spring when we were all really locking down. And so people are maybe visiting with a friend or an extended family member. And that visit is taking place before symptoms show up. So, I really love the cheesecloth or the cheese analogy from at the end of the last presentation, because there are many ways to fight the disease. Vaccines are one, and we're so excited for them to be present. But when we have family visits and friend visits, we need to think about other ways that we can protect ourselves. So on the next slide here, it emphasizes we really still need to be vigilant. We need to think the way we were thinking last spring. We still do have very high community transmission. We're trying to open our schools again, get kids back in. There's a lot of reason to really be cautious and work toward what we want to have happen in our community. And the vaccine rollout is going to take a while, and herd immunity, as the doctor was saying, is going to take a while. It's winter. We're all still indoors. There's not a lot of ventilation happening when we visit with one another. And then we have these new variants that are showing up, and there's evidence that there's greater transmissibility. So we really need to think strategically when we are around people. For myself, if anyone enters my house, I've got the windows open, I've got the fan going, I've got, the wood stove or the heater cranked up, but we're wearing masks, and, we're really being cautious. On the next slide here, for those who are not eligible yet for the vaccine, many of us are really waiting, and as soon as we can get it, we'll do our best to get it. But in the meantime, there are risks. We can reduce our risk. Like I said, we can certainly minimize our exposures. Think about maybe bulk shopping in the way that we did, again, last spring. Fewer visits to the grocery store, shorter time when we visit with a friend or family member, maximizing that ventilation. And then one thing that Dr. Fauci, I love that he was emphasizing, and others are picking up his lead on masking better, maybe double masking, considering wearing a surgical mask with a cloth mask over that, or filters inside your cloth mask. The goal is to reduce the gaps around the face, between the mask and the face. You want the air to go through the mask in either direction. And it's winter. People love wearing their neck gaiters. Especially, I noticed a lot of folks that are working with their hands, and they're, kind of involved in physical exertion, and maybe the other masks are uncomfortable, so they're wearing these neck gaiters. Unfortunately, the fabrics that they're made of, these stretch fabrics, are not at all protecting them from COVID or protecting others if they happen to be infected. So really want to think twice about that. And then one thing that I'm really emphasizing, because I'm hearing so much from people, you can see on the next slide, so many people are having really just minor symptoms or no symptoms at all. So the emphasis is on, really having a high index of suspicion. If you've got mostly when I talk with people who are confirmed COVID cases in Easthampton, The only things they're mentioning are maybe they had a runny nose, some nasal congestion, diarrhea, which is something people are not associating with COVID, a headache that's not easily explained away by, dehydration or up too late the night before kind of thing, unusual fatigue and muscle aches. And then, like I said, often no symptoms at all. But as this little graphic shows, everyone is just as infectious and contagious, easy to spread it regardless of what your symptoms might be. So on the next slide, we're talking about, there's an emphasis with the Massachusetts Department of Public Health now, stop the spread. Maybe you've heard this slogan. What it refers to is an initiative to get tested more regularly, especially if you're asymptomatic and you're thinking you're at no risk. And so maybe you're letting your guard down a little bit with your own practices. If you work indoors around other people, especially if you're in a public facing position or role, the idea is to get tested regularly so you can catch a case sooner rather than later and therefore reduce the spread to other people. If you have any new unexplained symptom at all, consider getting tested. And then there's a lot of misinformation I'm finding out there about when to get tested if you have been exposed to somebody. So I just want to highlight that if you wait a full 5 days after your exposure to a known case or somebody who has symptoms and they're waiting for their own test result, if you wait 5 days after that exposure, we're going to catch about 95% of the cases that way. People who are getting tested a day or two after their exposure and saying, oh, I'm negative, I must be fine, I'll go back to work. That's how it's spreading. So just to counter some of the confusion out there, and you can always contact us at the Department of Health or contact your own physician. Like, we are very happy to help clear up some of that. So just to, in summary, I just want to show you on the city website, we've made it really easy. There's a great resource. On the next slide, you can see the homepage of Easthampton City webpage. There's an arrow here where the COVID-19 testing site locator is. And on the next slide, I'll show you what this is. This is from the Massachusetts Emergency Management Agency. I love this tool so much. It's so easy to use. You just type in either your zip code or your town, the distance you're willing to travel, and it brings up right away and shows you the distance, all of the testing sites nearby. If you click on any of them, this is not an active link, but if you were on this website and you clicked on any of them, it immediately shows you the hours of operation, whether or not you need an appointment, the phone number, and whether the testing site is for asymptomatic or symptomatic or both people. So again, so excited about that vaccine. This is so great. And we are definitely still in a place where we need to have, take all the precautions we can and stay safe out there. Hope to meet you all eventually, but hopefully not, because you've tested positive and I have to call. Thanks.
Thank you very much, Amy. Bree, ready to wrap up for us?
Yes. Let me pull mine up and then I'll share the screen again. Okay. Okay. Okay, so some of this may have been touched on, but I am really focusing on our regional clinics here in Northampton and Amherst. And like Dr. Levin and Dr. Garcia stated, there's several sites all throughout the state that you can go to, but our regional clinics that are most close by is Northampton and then Amherst. So I just kind of want to go up, touch on those, how to sign up and where to go if you need help. So we went over the phase schedule, but it's really important because if you are not in phase 2, step 1, then you are unfortunately not yet eligible. And the integrity of the clinics are really important. So we can't make exceptions for people if you're 74 or you're almost 75. Unfortunately, you really need to be eligible right now in order to get vaccinated. So hopefully step 2 of this phase will be here soon, but right now we are 75 plus or anyone in phase 1. So a little bit of the history of our emergency preparedness response. Easthampton is part of the Hampshire Public Health Preparedness Coalition, HPHPC, and it includes boards of health in Hampshire County, and funding is provided through the Mass Department of Public Health with a grant from CDC. HPHPC focuses mostly on emergency sheltering and emergency dispensing. And we have been planning for emergency dispensing for over a decade, and we have what we call EDS plans, emergency dispensing site plans, where we develop them and practice them and drill them each year for the event we ever have to mass vaccinate a population. And I used to never think we were going to have to do it. And to be honest, I never liked having to do the drills, but here we are, and we are very much have to do it. So our Hampshire County clinics that HPHPC has stood up are in Northampton at the Senior Center at 2 Conn Street and at Amherst High School at 21 Mattoon Street in Amherst. I know some people have called the Northampton Senior Center looking for more information. The Senior Center themselves are not putting on the clinic. It's just being hosted at the Senior Center. So don't call the Senior Center line looking for help. We'll get to where you should call in a few minutes. So emergency planning efforts are regional, and we work together with our 19 Hampshire County towns to pool all of our resources together. It doesn't make sense to have 19 shelters during an emergency, 19 vaccine clinics. So what we do is we kind of pool all of our resources together. We're fortunate that our regional clinic is right in Northampton, and these Hampshire County towns all support that clinic. So my department, myself and Amy, work at this clinic throughout the week. Our fire department, our paramedics are administering the vaccine. So we all kind of support the clinic that's in Northampton. So the Northampton clinic, if you are 75 plus and you'd like to sign up, you can go to northamptonma.gov. If you need assistance with signing up, you can call either the Council on Aging at 527-6151 or the health department at 529-1430. Please leave a message. Sometimes we're working remote or it's a weekend. All of the voicemails that you leave get forwarded straight to my email, and I'm checking my email all the time. So don't get discouraged if you leave a message. Sometimes we're calling you back 10 seconds later. So our admin assistant, Jackie, has been doing a lot of signing up, and she's doing an awesome job. I'm sure some of you have talked to her. So we're signing up people all throughout the day. So please leave a message. So this is what the Northampton site looks like. If you scroll down just a tiny bit, you'll come to this box right here, COVID-19 vaccination clinics. And if you click that, it will bring you to this site. And if you are either in phase 1 or you are in phase 2 and you're 75 plus, you can click on one of these and just schedule right then and there. If you need help, you can call either 211, like we stated before, or you can call either the Council on Aging or the health department, and we'll pull this same site up and just talk to you over the phone and sign you up. So there is a wait list if you are not yet 75, but you fall under the second step of phase 2, which is 65 plus or 2+ comorbidities. The wait list can be found on the same site, and I'll show you what that looks like in a minute. It's important just to note that there is no email confirmation when you sign up for the wait list. So we have gotten some calls from people saying, I never got an email saying that it went through. Are you sure it went through? All of these submissions are going through. You're just not going to get any email right off the bat. You will get contacted once step 2 of phase 2 opens. And one thing that Jackie brought up the other day was when you're almost done on the wait list, it says, thank you for signing up on the wait list, but you still have to hit the submit button. So just make sure you hit submit at the end to make sure it does go through. This is what the wait list looks like. It's same site where we were before, and you're just going to click over here, phase 2, 65 plus, and then click here for waiting list. Comorbidities, the doctors from CDH went over already, but it's cancer, chronic kidney disease, severe obesity, pregnancy, smoking, all those things. I did see something in the chat about, are we going to have to prove our comorbidities? I don't know as of right now. I know that for signing up now as 75 plus, you are just attesting that you are 75 and they're using the honor system. They do check identification at the clinic. I'm not positive if they're going to require any proof, but I'm sure that will be announced once the second step is open. The Amherst clinic, I don't know much about. I don't personally work at this clinic, but it is a Hampshire County clinic that is available to you. And it's the same type of thing. You go to amherstcovid19.org/vaccine, and we can help you sign up there as well. Transportation, if you need transportation, you can call the Council on Aging and set that up with them at 527-6151. And then there's plenty of other statewide clinics you can go to. Just if you live in Hampshire County, that doesn't mean you have to go to these regional clinics. I just wanted to speak about them today because that's where a lot of people want to go, but you can go to the Eastfield Mall. I think Big Y in Northampton, there's other sites around. There is an interactive map similar to the testing site map. There's an interactive map for the vaccine clinics. I think we showed this earlier, but you can also download a list on Microsoft Word or Excel that will, same type of thing, tell you the hours of operation and kind of the details on how to get in there. So what to expect at the Northampton site: arrive on time for your appointment. Do not come too early. I know a lot of people, myself included, I like to be early to everything, but they're probably going to have you go sit back in your car because they cannot have too many people in the clinic at once. So try to get there a couple minutes early is okay, but try not to get there 15-20 minutes early. The greeter at the door is going to have you sanitize your hands, double mask. The second mask will be provided, and you'll go to a registration table. Bring some form of ID. And once checked in, you will take a seat. You'll have to fill out a questionnaire. Again, a lot of people fill it out when they're signing up, but you have to fill it. It's a quick, I think, 10-question questionnaire for the vaccinators to look over. And then groups of 5 are called in together. Expect to be at the clinic for 30 to 60 minutes. There is that mandatory 15-minute observation period. And so once you get your shot, you will be observed for 15 minutes in that same group of 5. And dress warm in the event that you do have to wait a few minutes outside while they're sanitizing the chairs in between people, but try to wear a short sleeve under your jacket so your arm is easily accessible for getting the vaccine. And you will receive a vaccine card with the brand of vaccine, lot number, date the vaccination was administered, and the location. If you signed up by email, an email will be sent to you to schedule your second shot. We went over this. Moderna's 28 days later, Pfizer's 21 days apart. The second doses should not be given any earlier. I'm not sure how much later is okay. I don't know if the doctors want to maybe speak on that after, but you just don't want to go any earlier. And it may take a few days to get the email. The clinic staff in Northampton, there's, as you can imagine, a ton of calls, ton of emails. So don't panic if you don't get your email right away. You will get one. If you go 1 to 2 weeks without receiving an email, feel free to reach out to us. I don't want you to miss your second shot, but if you don't get it 24 hours later, there's no need to panic. And please continue to wear your mask, socially distance, follow all protocol after you receive the vaccine. It's not 100%. So I know the CDC did come out today with some more information about, if you have to quarantine after getting your vaccine or not. But again, especially after your first shot, you are not 100%. So these are some FAQs that are the coordinator at the clinic actually sent to me. So I thought that I would share them with you. If I'm 77 and my wife is 74, can she get the vaccine now because we live in the same household? So the answer is kind of yes and no. Prior, it was no. The husband is not eligible because, or the husband is eligible because he is over 75, but the wife is unfortunately under 75. However, the state did just announce yesterday, I believe, that caretakers could be given the vaccine if they bring somebody to the clinic. Right now, I think the mass vaccination clinics like the Eastfield Mall will honor that, but I'm not sure right now that our regional clinics are going to be able to handle that with the amount of vaccine that they get. So I'm not sure right now if that will be honored. So if you do want to take advantage of that, I would go to the Eastfield Mall. And when do you think step 2 of phase 2 will be opened? We don't know, hopefully by mid-March, the latest. My daughter takes care of me. Is she considered a home health care worker? Home health care workers were eligible in phase 1. The answer is no. If you are a family member taking care of another family member, you're not considered a home health care worker. That was eligible for phase 1. Home health care workers service multiple patients in multiple homes. And why do you need my insurance information? I thought there was no charge for the vaccine. We went over this earlier, but the vaccine is being provided at no cost to you by the government. Your insurance company may be charged for the cost of administering the vaccine. There's no out-of-pocket expense for you. If there are any veterans that need assistance, our Veteran Service Agent, Michael Slater, his information is on the screen. He can be reached at mslater@easthamptonma.gov or at 529-1415 extension 119. And then any questions? I wanted to put my website on there. Information, as you can see, CDH had something change this morning. I had something change on me yesterday. Things are changing very rapidly. So check our website for updates, our Facebook page. I know not everyone's on Facebook, but I do keep that up to date, and to email us. Our normal business hours are Monday through Thursday, but like I said, I'm checking email Fridays on the weekends, so it may not be as fast of a response, but again, don't get discouraged if you have to leave a message. Most people do, and we just, we get that after. So I'm gonna stop sharing the screen and see if there's any.
Thank you very much, Bree, and to all of our panelists. We have a couple of questions, and I'm going to ask Karen to unmute and help with some translation, if that's okay. So from Janet Rivera, she asks, if you get a reaction the first time around and can't get the next shot, why should we have to take the risk?
I guess I'm not quite understanding the question. It's very rare for people to get an allergic reaction. Most people tolerate the vaccine well, although many people get a sore arm or get low-grade fever or muscle aches. Those are not considered severe reactions or a reason not to get the second vaccine. So it's only in the very, very rare cases where people have severe allergy where they shouldn't get the second shot. The reason to get the vaccine, of course, is because the disease is quite severe for some people, and the risk of the vaccine, in my estimation, is much lower than the risk of the disease.
Bien, y en español, el riesgo de tener la vacuna es no muy alto si la reacción alérgica fue solamente un poco de dolor o un poco de que estuvo un poco con fiebre. Si la reacción alérgica no fue grave, el riesgo es muy bajo, y el riesgo de recibir COVID y tener que enfrentar COVID es muy alto. Y la recomendación de la doctora es, sí, es el riesgo de no tomar la vacuna por una reacción mínima, es mejor tomar la segunda dosis.
Thank you, Karen. We have another question. How do we know if the vaccine is fresh?
So we know that, I mean, the way the vaccine, each vaccine requires certain storage and handling, but certainly every agency that's working with the vaccine, it's shipped frozen, it's shipped on ice. We keep them at whatever temperature they need to stay at. So all of that is reassuring, and we have a certain amount of time, usually up to 6 hours, to use the vaccine. So once it's kind of reconstituted and put into the syringe to be given. So I think that's the way we know, is we're following all the CDC guidelines to make sure that it's fresh and used timely.
I think all the staff who work in the vaccine clinics, and certainly the folks who run the clinics, know the rules about how long it can be out of the fridge, and they do have to pay attention to that, and they do.
very much, doctors. Karen, do you want to give a brief translation?
Sí, la pregunta es cómo sabemos que la vacuna es fresca, y los médicos nos informan que están siguiendo todas las reglas que han sido establecidas, desde cuánto hay que mantenerlos refrigeradas, que hay un periodo de 6 horas en que puede ser administrada, y están siguiendo esos periodos muy puntualmente.
Thank you very much. We have one last question are there any plans for drive-through vaccination centers now or for later phases?
So I know right now there are not any plans for drive-throughs in these early phases. One of the restrictions that first comes to mind is the 15-minute observation period. It would just be hard. We wouldn't be able to do as many people as we've been able to do, like at flu clinics where we just give someone a shot and they drive off. We have that 15-minute observation period. That's definitely, I know a lot of people enjoy the drive-through format, so it's definitely a thought maybe when the vaccine's a little bit more readily available, but when we're having this, mass amounts of people coming at once, I don't think it's going to happen anytime soon until maybe general population.
I think you're right, and we were on a call today where they talked about trying this at one of the local facilities, and it was very difficult. They said, trying to watch the patient and then pull them out of, they said we actually tried to pull them out of the car because somebody was having a reaction, and then you need to put them in a wheelchair, take them inside. Very rare that it occurs, but that's why we watch you for 15 minutes. So right now, that's not something we're recommending. I agree.
Thank you very much. I want to be mindful of everyone's time. It's 7 o'clock on the dot. Thank you very much to all of our panelists. We're so fortunate and grateful to have just high quality, dedicated public health servants in the area helping us through this extraordinarily difficult time. I'd also like to thank Easthampton Media, who is going to take the recording and post it on their YouTube channel. There will be re-recordings on 193, the cable access channel. The link will also be on the city website. I'll also thank you to Representative Dan Carey, who's been fighting with the rest of the delegation to get Western Mass more vaccines. And lastly, if you have questions, you can call the Easthampton Health Department. Bree, do you want to say that number one more time before we wrap up?
Yeah, it's 529-1430.
Okay, thank you very much. Please mask up, wash your hands, and if you can, and as much as possible, stay home. Take care. Thank you very much for watching, and please don't hesitate to reach out to us and ask questions. Take care. Bye-bye.